30 major hospital systems just told seniors, we're out.
Months ago, I told you that the impact of Medicare Advantage disenrollments was going to be significant for 2026, and boy, is it. The actual data has come out from CMS now, and we know exactly what those numbers are, but more than that, now 30 hospital systems across the country have said they want nothing or very little to do with Medicare Advantage for next year. So what does that mean? It means that maybe even you're not losing your Medicare Advantage plan, but the hospitals that you counted on, some of the biggest names in the country, are no longer going to accept Medicare Advantage at all. Let's get into it. So we know that 2 million people are impacted, give or take a little bit, and UnitedHealthcare is the biggest, most significant one in that. 30 hospital systems, as I said, are going to take no Advantage plans or have greatly scaled back who they're going to take. 600,000 people just with UnitedHealthcare alone. So we're going to get into UnitedHealthcare's impact and look specifically at one state, Vermont, because boy, is it horrible for those poor folks. We'll talk about the rest of the country too. Which hospital systems are the biggest names that are getting out? And more importantly, what are your options for the new year? So UnitedHealthcare, they said 600,000 people, and if that's what they went into on their investor call, 180,000 of those are in the PPO plan. That's because they had freedom and access to go anywhere that they wanted to go to. So what does that mean? It means there are a lot of people going to get a letter that says you have no longer your plan for next year. The PPOs were good because it did give you freedom of choice. Not as much as a Medicare supplement plan, which we'll get into in just a minute, but the PPO said there's an in-network and an out-of-network benefit. The caveat is you have to pay the difference, and it's very significant if you go outside of their network. The providers on a PPO plan can decide from one procedure to the next whether they're going to accept your Medicare Advantage PPO, but they were billed as an out-of-network option. And what they're doing is they're scaling back those options now and putting people into more restrictive plans. That's the only plans they're going to have available in the majority of the country. That means more restrictions, tighter controls. You must go to a primary care doctor, and they're going to manage your care. You know what it means when an insurance company says they're going to manage your care? It means they're going to have a lot of denials built into the system, and you're going to have less options that you can go through. Let's look at Vermont real quick. Vermont is getting rid of all of its Medicare Advantage options except for one. Humana is going to still be there. And where they're going to be in Vermont? 6 counties. That's it. Everybody else, not going to have a Medicare Advantage option at all. So we'll talk about the Medicare supplement option that you do have. But those counties that have coverage, I've listed them here. And for the other counties for 2026, no Medicare Advantage options whatsoever. And it's not just Vermont. Just looked at it as a snapshot. In New Hampshire alone, 75,000 people affected there. So why are the plans leaving? Well, they'll say that it's lack of federal funding. And that's partially true. 2 years ago, and for the last 2 years before this year, the Biden administration did cut back just slightly the funding for Medicare Advantage. And you couple with that regulatory changes. They've been bracing for impact of the planned audits, where the government has said for years, especially this year, they're going to hire all these auditors and come after them for their illegal practices. And that remains to be seen, but they're trying to plan for that. And then they're saying that higher patient costs are driving everything. Medical cost inflation, people having more things done than ever in the past. And we've seen that on the Medicare supplement side, the Medigap side, with the drastic rate increases that they've been having. And if you look at their claims and their claims loss ratios, they are tremendous. So all these things factor into one, and that is the Medicare Advantage companies have been squeezed. Now, to put some context on it, the Trump administration did give them a 5% boost for 2026, and that was just announced in 2025. They have more room to make up to get back to where they were. They're definitely not even yet. So providers are frustrated with Medicare Advantage too. We've covered it on this channel many times. The providers are so frustrated with prior authorization. The government actually listened, this administration did, and they had the big press conference where they talked about they're going to get the insurance companies to voluntarily scale back their prior authorization.
For patients. This is a critical issue because imagine you're in a doctor's office and you've got a bad diagnosis and there's a procedure or a test or a treatment that you think is right for you, and you find out that you can't start that treatment for sometimes weeks, even longer. It's more frustrating than anything else in the process because at least that's something you do control. You don't control much else when you're in a physician's office with that kind of a crisis, and yet it's withheld. And these approvals with this new pledge will be streamlined. It will happen very quickly. Necessary care will be delivered when it's needed in the right way. So you get both quality and you get timing, which goes along with that quality.
Well, what does that do? That adds cost to them because prior authorization is one of the biggest components of how they're able to save money. They save money by denying care. And how do they do denial of care easiest? They say that if something's going to cost a lot of money, they're not going to pay for it right off the bat. And so what do people do? Sometimes, only in about 13% of the cases, they will appeal. And if you appeal, you have about an 88% chance of getting it approved for yourself. So if you get a denial across the board for Medicare Advantage for anything, please, please, please consider doing an appeal. Doctors, they're saying that the administrative burden, staying on the phone with the insurance company, not getting paid, these are the exact same things that are cited by the hospital networks that I'm going to mention in just a second, that have said why the hospitals don't want to participate in Medicare Advantage going forward. So you have the plans pulling back, you have the hospitals saying they're not going to take them anymore. It's a heck of a situation. So this is something from a Vermont representative from the Department of Insurance there. It says, anytime there's massive disruption like this, you worry about the people who are going to slip through the cracks. And that's why I want you to pay attention to this video right now. It's because if you do nothing, if you just throw the letter away, or you just assume that everything from last year is going to be the same for next year, you could be sadly mistaken, and you could be stuck without a Medicare Advantage plan at all for the upcoming year. If that's what you're going to do, Medicare Advantage, then you'd be thrown back on original Medicare, no Medicare Advantage plan, no copays or anything like that. You just have some massive costs that you'd be looking at. We don't want that to happen. So please pay attention to this, and please share this with somebody that's on Medicare. So what do you want to do? Not assume that your plan's going to be the same, because it's not. In the majority of cases, plans are changing. And if you just look at your plan and say, wait, it's still available. My plan's available. Chris said it was going to be going away. Okay, well, if it's still available, what are the changes that are being pulled back their money on your particular plan? We've heard all kinds of things like, my doctor's not in the network anymore, the practice is no longer there, the hospital's not there anymore. And the doctor networks are shrinking unless they're owned by the Advantage plan. And more, and that's why some people are saying that Congress needs to get involved. So the doctors' practices cannot all be bought up by a Medicare Advantage insurer. Also, in your drug plan, make sure that you know what's changing with the formulary. You understand that people are excited about that 2026 max out of pocket on the drug plans. It's $2,100 for 2026. But that only applies if the drug is covered in their ever shrinking formulary. If it's not on the list, it's not covered, and it does not go toward that max out of pocket on the drugs.
The Inflation Reduction Act
Yes.
presumably capped drug expense, out-of-pocket drug expenses at what, $2,000 per year?
Yep. The $2,000 spending limit only applies when the medications are covered by your Part D drug plan. If your medications are not covered by your Part D drug plan next year, no $2,000 spending limit applies. You will pay the full retail price for that medication, whether that medication is $200 a month or $20,000 a month. That's yours to pay. And remember, plans that covered your medication this year may not be covering that medication next year. They can change what's called drug formularies. Drug formularies are the list of medications that the plan covers.
So please look at the drugs on the list and see if they're going to be covered for you. That could have a significant impact. Now, those 30 major hospital systems that have said they're not going to participate at all or as much in Medicare Advantage for next year include Johns Hopkins, some of the biggest names in the industry. They're saying that that's going to impact 60,000 people affected just with United Healthcare alone. They're just not going to take them.
On August 25th, 60,000 United Healthcare members lost in-network access to their Johns Hopkins doctors, care teams, and specialists. The hospital system said after 8 months of negotiations, they couldn't find common ground, accusing the insurer of putting profits over patients with what they call excessive prior authorization requirements, frequent treatment denials, administrative burdens, and delayed payments. United Healthcare disputes that. The company says it was preparing to send a counter-proposal September 15th until Hopkins told them not to bother.
Our number one priority is to make sure that Maryland consumers are not caught in the middle between these two giants.
The Maryland Insurance Commissioner says her office can't force a deal, but they're investigating the adequacy of United's networks without Johns Hopkins Health System and Capital Women's Care.
They need to have adequate providers that can see Marylanders for all kinds of conditions. Maryland doesn't see these kinds of disputes very often, and in part that's because of our rate regulation for hospitals. There's not necessarily as much to fight about in Maryland when rates are set between big hospital systems and insurers.
Brown University, United Healthcare. They don't want them anymore. MUSC here in Charleston, South Carolina, they're not going to take Humana anymore. And so in the South, in the Southeast, we're having Memorial Healthcare, that's a big one, Wake Med, and then Vanderbilt, not going to take Blue Cross. So here are some other ones in the Midwest. Ohio State Wexner, that's going to impact some people. Trinity Health in Michigan. Allina in Minneapolis, that's only 18,000 people. And then Essentia, that just came out in the news. So all these places are saying, you know what? We're tired of not getting paid. We're tired of the prior authorization. We're tired of the administration, the administrative hurdles that they've got. And these are some big names. Sloan Kettering, Vanderbilt, MUSC here is the training hospital, the teaching hospital. These are some significant frontline, best of the best healthcare systems. And typically with Medicare Advantage, you're not going to see these good of a hospital systems in there because they just cost too much. So if you stay on a Medicare Advantage plan or you go to another Medicare Advantage plan, typically with a Medicare Advantage plan, what you get in January is what you're stuck with for the entire year. You can't just change an Advantage plan because they lost your doctor. They lost your hospital system. That's not a reason for you to be able to change. Now, there was an exception to that in the state of Rhode Island. They had a very big situation there where an entire hospital network left, and the Department of Insurance actually applied to CMS and said, we have so many people impacted by this one provider leaving Medicare Advantage that we need a special enrollment period for this situation. And it was granted by CMS because the head of the Department of Insurance of Rhode Island requested it. But if it's just you and your neighbor and your Advantage plan is suffering the loss of one of these major hospital systems, don't rely on a special enrollment period later in the year as you discover that. It may show up in your provider directory right now, but the truth is it could go away. And if your hospital or your doctor go away in the middle of the year, that is not a reason that grants you an opportunity to change your Medicare Advantage plan. Just have to tell you that up front. If you get a termination letter from your health plan, you need to save that letter. That is your golden ticket to get into another plan later because you have an enrollment period that lasts through February. You don't want to wait that long. I'll show you the dates here in a minute. You don't want to wait that long. Or you could go to Original Medicare, which is no networks whatsoever, any doctor, any hospital, coast to coast that accepts Original Medicare. No referrals required, go directly to specialists. No prior authorization, you don't have to get someone's permission. If your doctor says you need something, then it's approved. And you couple Original Medicare with a supplement plan to pay those costs that Original Medicare does not cover. And on the outpatient side, Part B, that's 20% is not covered by Original Medicare. So save this golden ticket and you can look at your options. So the golden ticket gives you guarantee issue rights to Medicare supplement. What does that mean? It means that there are no health questions. Typically with a Medicare supplement plan, Medigap, unless you get one when you're brand new to Medicare, either just starting Medicare because you worked on an employer plan longer than 65 years old, or when you're turning 65, you get an open enrollment. That's the true definition of open enrollment. Open enrollment means you can get any plan that's out there. You can get any Medigap plan, you can get any Medicare Advantage plan, you can get a Part D standalone drug plan, and no one's going to question you. When that's over, the only time you can get a Medicare supplement plan, a Medigap plan, to go with Original Medicare is if something major like this happens, like you had a Medicare Advantage plan and that plan is going away. It's important that if they're going to take you, you have this one get out of jail free golden ticket that you can use. It's important if you get that letter from the insurance company saying you're losing your plan, hold on to that plan. You should actually get one from CMS, Center for Medicare and Medicaid Services, and your insurance company. Hold on to that. So here's what you should do right now. Check your mail. If you've not yet received your annual notice of change, it's probably lost in the mail, or what so many people did, they checked the box when they initially enrolled and said, it's okay, send it to my email. So maybe it went to your email, maybe it got stuck in a spam folder. If you don't have your annual notice of change, request it from your current insurance company. If you got your termination letter, now you need to get to work. And we can look at those plans that are available for you. And you need to determine, are you going to go to another Medicare Advantage plan if one is even available in your state? You've got original Medicare, and we need to see if you can afford a Medicare supplement plan, because you don't want to be hanging out there just with original Medicare if you can at all avoid it. So here are the paths you can do. And again, when you first start with Medicare, you have these options. Well, now you have some of these options if you're losing your plan. See, some people go with traditional Medicare. Part A and B. Part A is in the hospital. Part B is everything outside the hospital. And that's where the tricks come in. It's that 20% that's not covered. We're talking MRIs, CAT scans, knee replacement if they're doing it on an outpatient basis, an ambulance ride, the time you spend in the emergency room. These are some big costs until you're admitted into the hospital. And if they're just treating you on Part B stuff, which is the vast majority of everything, how many of you know people who've had knee replacement or shoulder surgery, arm whatever done to you that used to be a significant thing? You're staying overnight at least in the hospital. Now they're doing them on an outpatient basis. That's where everything's going. So the Part B is significantly important. And again, on original Medicare, you can go to any provider in the country that takes Medicare, which is most everybody. You could do that, but please think about pairing it with a Medigap plan so you don't have the exposure. You don't have the surprises. You have a monthly premium that you have to pay, but with that comes the flexibility and the freedom of original Medicare. And you'd want to couple that with a standalone Part D drug plan. And you can look at those at a website called startpartd.com, Part D for drug plan. If you're going to do a standalone plan, you can look at those for next year at startpartd.com. You've got from October 15th through December 7th. Now, on the other side, you've got Medicare Advantage. That's the other route you could go. If you go Medicare Advantage, you must participate with whatever their rules are. And their copays, their deductibles, their costs can change every single year. This year more than most, or like we said, done away with altogether. Here's my caution to you. If you're going to do Medicare Advantage, if you had one and you're going to keep it, or you're getting one this time for the first time because the cost on Medicare supplement have gone up so much in different parts of the country, especially Plan G. Why is that? Why do you think Plan G has been going up so much? I've talked about this endlessly for the last, since 2018, when the Medicare Modernization Act was passed by Congress to come into effect in 2020. I won't bore you with the minutia, but Plan G Medicare supplement for those people born after, eligible for Medicare after 2020. Plan G is the de facto recipient of all the guarantee issue people. Guarantee issue means those people who've lost their coverage, like right now. Those people who've been on Medicare, on an employer plan, but they're leaving their employer plan, they've got to get guarantee issue for one plan. Guess what? It's typically Plan G. Now, if you're older than that, you were on Medicare prior to January 1 of 2020, then your de facto go-to plan is Plan F, and those rate increases have been horrendous also. So Plan F and Plan G have to accept guarantee issue people, not just open enrollment people, not the new people that are healthy, brand new to Medicare. No, these are the potentially sick people, can't go through underwriting, and they've got their own golden ticket. So that's the plan you don't want to be on if you can avoid it. But other agents will say, wait a minute, Plan G is that simple plan, right? It's just got the simple deductible of Medicare, and after that's met, you can go to your heart's content, and there are no more costs associated with Plan G. That's right. And as a result of that, the utilization, which means when people are using that insurance, is way higher than the other plans. The other plan I'm talking about specifically is Plan N, as in Nancy, which is my mom's name. Plan N can only be obtained one of two different ways. One, through open enrollment. So you're new to Medicare. Typically, you're 65 years old. You're at the youngest. You're at the healthiest part of you'll ever be on Medicare. So that's one way to get it. The second one is if you go through underwriting, that is health questions. So for you people that are losing your Medicare Advantage plan, you could still get Plan N, and I'll tell you why you should consider it, but you'd have to answer some simple health questions. There's no blood work, there's no blood test, there's no exam. It's just simply answering some questions like, have you had a heart attack, stroke, or cancer in the last 5 years? Do you use a wheelchair, cane, or a walker for mobility during the day? Different things that. Those are the questions, the big things in life. Most people are surprised to find out that most people do qualify simply by answering no to all those health questions. And if you qualify for Plan N, it puts you in an elite category of people who are generally younger and brand new to Medicare, or they're healthy because they qualified to be in a risk pool that you qualified for. So guess what happens to the rate increases on Plan N? Across the country, we've seen this, and I've been tracking it at a website called plannmedicare.org. Look at it. Look at all the evidence from the last few years showing how Plan G rate increases have been skyrocketing, as much as 40% this year in several states. And Plan N, in the states where they look at the plans separately based on their experience, Plan N has consistently had lower and lower rate increases because of those two factors. It can't take guarantee issue people. It only takes healthy people or people that can qualify. So consider Plan N, and yes, you'd have to answer some health questions. But if you're going to be on Medicare Advantage now for the first time, or you're going to stay on Medicare Advantage, I want you to consider this. Add these two things: cancer insurance and a hospital indemnity plan. I'll tell you briefly why. Cancer is the biggest exposure that you have on Medicare Advantage for two reasons. One, they restrict what kind of treatment you can have, not only to the hospital systems where you can't go to, like Cancer Treatment Centers of America or MD Anderson. You're just not going to be able to go to those with most Medicare Advantage plans. And you might want the best treatment for your kind of cancer. Johns Hopkins, known for their brain cancer treatment, best in the whole wide world. Things like that are generally off limits to people on Medicare Advantage. So if you have cancer insurance, you can go and you can pay for it with cash, tax-free money paid in your pocket from the cancer insurance. And it's not that expensive. I have it myself. The other reason, on Medicare Advantage, they don't have the best facilities typically for cancer treatment, but even if they do, the copays for cancer treatment are typically, wait for it, 20% of the cost. Wait a minute. I've got insurance. The insurance is going to pay only 80% of the cost? Yeah, and that's only 80% of the cost that's approved by the insurance company. I can't tell you how many hundreds of stories I've heard of people with significant cancer. Their oncologist wants them to have a set number of treatments, and the health insurance company, if it's Medicare Advantage, says, no, you're only allowed to have 5 or 10, and the doctor wanted twice that. So Medicare Advantage may restrict the kind of care you can get from where, and the number of treatments that you can get. But if you have cancer insurance, cash money that you can pay out of your pocket for it, then suddenly that 20% that you have to pay on Medicare Advantage to your cancer treatment, like chemotherapy, radiation, those things, when they're going to leave you with paying 20%, you might as well have been on original Medicare with no other insurance, because that's what original Medicare, which I don't recommend you do, leaves you exposed to. 20% out of your pocket. Now, the Medicare Advantage people will say, the big salesmen that push it, they'll say, yeah, Chris, but if you're on Medicare Advantage, at least you have a maximum out of pocket that will protect you. And again, just like the maximum out of pocket on the Part D drug plan, it only applies to treatment and coverage that's been approved by the insurance company. So if the insurance company says you qualify for 10 treatments of chemotherapy, your doctor says you need 20, you believe you need 20, you even get a second opinion. Those 10 remaining things do not go towards your max out of pocket, where you don't have to pay for anything else again. Why? Because they weren't approved by the insurance company. Trust me, I've seen so many cases where cancer insurance has literally saved the day. And I know some agents around the country that will not get you a Medicare Advantage plan. They want nothing to do with it if you don't get a cancer plan also. That's to protect you. So if you don't have cancer insurance and you haven't had cancer in the last 5 years, please look into getting it. You really should. And the other one is hospital indemnity. One of the things that's drastically changing on a lot of these health plans this year, Medicare Advantage plans, is the hospital copays. They're going up, sometimes dramatically. It can be as high as $750 per day. So what a hospital indemnity plan does is it pays those copays for you. So if you're in a hospital for, let's say, $500 a day for 5 days, that's $2,500 you're expected to pay when you've gone to the hospital just the one time. So a hospital indemnity plan can be like $30 or $40 per month. And the majority of Medicare Advantage plans still are going to be 0 monthly premium. That's the enticement, is to not charge you a monthly premium so that you kind of don't pay attention to the small print. This is one of the big small print things, big small print, that's like jumbo shrimp, that you should really, really pay attention to. And a hospital indemnity plan can be tailored to fit those needs of your Medicare Advantage. Now, in all transparency, it will not pay for things that are not covered. It'll only help you pay the copays of things that are being charged to you by the health plan. So consider that, especially if you're at 0 premium. It could save you a lot out of your pocket. So here are the critical deadlines. The annual enrollment period is October 15th through December 7th. That's if you want to get on a Medicare Advantage plan, or if you're considering changing your drug plan, which you can do at startpartd.com. Those things have to be done before midnight, December 7th. And I'll tell you, in our office, the slots on our calendar are filling up fast. And you can book that. I'll give you a link here in just a minute, or you can call our office. Get on the schedule. You have to have an appointment. You can't just call up same day and get enrolled in the plan because of Medicare's marketing rules. There has to be a cooling off period and a scope of appointment, which is a permission slip obtained by you before an agent can talk to you about it. So if you're going to make an appointment for the annual election period, I really encourage you to make that appointment now. Here's the funny thing. If you make an appointment and then later you change your mind, let's say you signed up for one health insurance company, but later you hear something about a different one and it looks like it's even better and you just found out about it, yes, you can change your mind. The last enrollment at December 7th at midnight, Pearl Harbor Day, a day which will live in infamy, and also my birthday, that day is the end. And you can apply 30 different times. The last one in on midnight, December 7th, is the one that's going to kick in January 1st of the next year. That's when the coverage takes effect. Now, if you're on a Medicare supplement plan, let me talk to y'all for just a second. Medicare supplement plans do not change. They don't change from year to year. They don't go away. They don't change your copays. They just pay all the bills for you. They don't change their networks. They don't have hospitals that just drop out of original Medicare. It just doesn't happen. So if you're on original Medicare with a Medicare supplement plan, I want to encourage you, yes, you can shop your plan, but this is not the best time of the year to do it. Why? Because we have this finite period, 55 days, where Medicare Advantage people disrupted this year way higher than in any year past. Those people have to find an alternative, and they only have this small finite window of time to do that, and they have to change drug plans and all the rest. So this is not the best time to shop a Medicare supplement plan. If you need to do it, you absolutely feel like you have to do it right this minute, then we can try to accommodate it. I'm just letting you know that the agents around the country are really concerned about the finite period of time that people on Medicare Advantage with this much disruption have in order to help those folks. So we're trying to get as many people on Medicare Advantage that need to an appointment or that need to switch or find another one. That's what's going on there. Medicare supplement, it's just not going to change. Here's our phone number. If you'd like some free advice, if you'd like a second opinion, if you'd like somebody that can actually help you without being biased as to whether you go to a Medicare Advantage plan or Medicare supplement. Sometimes people don't have a choice. Listen, I've read thousands of comments from my YouTube channel lately where people are saying, I've been on a Medicare supplement. I appreciated the freedom. I love the ability to go anywhere and everywhere that I could go for my whole life. But just for some reason, now my finances will no longer allow me to stay on original Medicare with a Medigap plan, Medicare supplement. If that's the case, first I would exhaust all remedies to shop that plan and make sure you've got the lowest possible rate, because while plan N from one company is the exact same as plan N from another company, there may be a deviation in the rate, a very significant number, like hundreds of dollars per month. We've seen that. And routinely, for the last 27 years, I've helped people go from a high rate to a low rate and keep the same plan. You may be on the right plan for you, just with the wrong company. And Medicare doesn't care, your doctor doesn't care who pays the bills. If you're on a Medicare supplement, be on the lowest priced one. and we can help with that. So again, if you want to book an appointment, it's right there. SeniorSavingsNetwork.org/AEP. That's our calendar for this period of time. And that's for people who are on Medicare Advantage or want to be on Medicare Advantage, maybe for the first time, maybe switching, maybe losing your coverage. And we can look at all the options available. We're not going to try to shove you into round peg into a square hole or whatever that euphemism is. We want to listen to you, see what's important to you, see what your budget allows you to have. The best coverage that's out there is Original Medicare with a Medicare supplement and a Part D standalone drug plan. That just can't be purchased by everybody. Some people just have Social Security and they just have to take what's available. And that's why we're trying to be all things to all people and give guidance and help. We don't have every company in the market. We don't. We only have companies that we've selected to contract with. We don't have 𝗲𝗵𝗆 HMO in Backwater, Texas. We're just not going to contract with those plans. We look very carefully at who we decide to do business with. We're in all 50 states and Washington, D.C., and we can help you, so let us know if we can. And there's a subscribe button there. You really should subscribe to future updates because they'll be here to help you as things change with Medicare. Please share this with someone who's gotten that letter and they're freaking out and they don't know what to do. We'll be here to help. Thanks for watching. God bless you. Bye-bye.